Have you ever wondered what happens when your body suddenly stops making blood? When your bone marrow, the factory of life, falls silent? This is aplastic anemia, a life-threatening disorder where your bone marrow fails to produce blood cells. Let's understand it step by step. Definition: aplastic anemia is defined as a condition in which an acellular or markedly hypocellular bone marrow results in pancytopenia. That means anemia, granulocytopenia, and thrombocytopenia, without any leukemic or abnormal cells in the marrow. Classification: it is classified into 1. Congenital forms, like Fanconi's anemia and diamond blackfin anemia. 2. Acquired forms, which may be primary or idiopathic, with no definite cause, or secondary, where a definite or likely agent can be identified. Etiology: causes. Secondary causes include cytotoxic drugs, such as alkylating agents and antimetabolites, drug-induced aplasia due to antibacterial drugs like chloramphenicol, sulfonamides, isoniazid, tranquilizers like chlorpromazine, meprobamate, antirheumatic drugs such as phenylbutazone, gold salts, diclofenac D-penicillamine, antidiabetic drugs like tolbutamide, chloropropamide, and miscellaneous drugs like carbamazole, hydralazine, carbamazepine. Chemicals like benzene, DDT, and lindane can also damage the marrow. Viral infections such as hepatitis, HIV, parvovirus, and infectious mononucleosis are known triggers. And other miscellaneous causes include radiation, paroxysmal nocturnal hemoglobinuria, pancreatitis, and eosinophilic fasciitis. Clinical features: the symptoms arise due to pancytopenia. Anemia causes weakness, fatigue, pallor, and breathlessness on exertion. Granulocytopenia leads to frequent infections, sore throat, mouth ulcers, fever, pneumonia, and septicemia. Thrombocytopenia causes bleeding, petechiae, gum bleeding, menorrhagia, or even retinal and cerebral hemorrhage. On physical examination, jaundice, lymphadenopathy, and splenomegaly are characteristically absent. Investigations: hemoglobin is reduced, reticulocyte count is low, peripheral smear shows pancytopenia, normocytic normochromic anemia, and neutropenia with relative lymphocytosis. Bone marrow is markedly hypocellular or acellular, with increased fat cells and iron stores. Serum iron and transferrin saturation are increased. Ferrokinetic studies show delayed clearance of radioactive iron. Severe aplasia is diagnosed when at least 2 of these are present. Platelet count below 20,000 per microliter. Granulocyte count below 500 per microliter. Reticulocyte count below 1%. Management: conventional medicine. Remove the causative agent wherever possible. Supportive care: prevent and treat infections, manage bleeding, and give red cell transfusions for symptomatic anemia. Bone marrow transplantation is the treatment of choice in patients under 50 years with HLA-identical donors. Medical therapy for others includes antilymphocyte globulin, ALG, or antithymocyte globulin, ATG, often combined with cyclosporin. Androgens, like oxymethylone, may help in moderate cases. Steroids are mainly used to prevent serum sickness during ATG therapy. Homeopathic management: homeopathy aims to gently stimulate bone marrow function and restore vitality. Some indicated remedies include China officinalis, for extreme weakness and pallor after blood loss; Ferrum phosphoricum, in early stages of anemia with easy fatigue; Calcarea phosphorica, for delayed marrow recovery and weakness; Natrum muriaticum, for thin, pale patients, weakness after grief; phosphorus, for bone marrow suppression and bleeding tendency. Homeopathy focuses on individualized treatment, enhancing the body's ability to regenerate and heal from within. Aplastic anemia may be rare, but with early diagnosis, proper care, and holistic support, recovery is possible. Follow at ShilpaDias for more medical and homeopathic insights.